my name is Liliane Landeiro, and I'm going to be validating on preparing and maintaining a sterile field. So the first thing I'm going to do is tape a garbage bag to the station, which is already here. I'm also going to place the tapes that I'm going to need for the dressing on the table. And I'm going to state my 7 steps, which are check the physician's order, wash my hands, organize my equipment, identify the patient, introduce myself, explain the procedure, and provide for privacy. Now I'm going to begin setting up my sterile field. First I'm going to have the drape. I'm going to open it away from me, and I'm going to get it by the corners, and I'm going to discard of this. One inch around it is considered contaminated. My basin. Dispose of it. And I'm going to get my pads that I need. I have my ABD pad. Dispose of it. And then I'm going to have my gauze pads. I'm going to have 3 for cleaning. I have 2 for packing. And 2 to cover the wet dressing. 2 dry ones to cover the wet dressing. Then I'm going to put on my gloves, walk to the patient's room, identify the patient. I'm going to put the bed in my working height. Remove the dressing slowly, making sure not to pull anything out. And remove anything that's packed in there. Dispose of it. I'm going to assess the wound for the drainage or anything. I'm going to remove these gloves. Dispose of it. With the sterile water, I'm going to check if it was opened. If it was open for more than 24 hours, I would dispose of it. And if not, I would lip some. And I'll put some in here. I will then put on my sterile gloves. I'm going to clean the wound, starting from the middle, top to bottom, only using it once. Dispose of it. The sides. Dispose of it. The other side. Then I'm going to pack the wound. and I'm going to cover it with two dry gauze pads. And cover it with an AVD pad. I'm going to remove my gloves. Put the patient in a comfortable position. Put the call bell by his reach. Put the head of the bed in its lowest position. I'm going to get rid of my sterile field. I'm going to reassess the patient, making sure he's okay. I'm going to wash my hands, and then I'm going to record the procedure, any observations, and the patient's tolerance on the patient's record.